Larson, it's good to see you.
Hi, Dr. Pello. Good to see you as well.
You're here for your left ankle?
I am.
Hey, Dragon, let's get started. I'm seeing Miss Larson. She's a 44-year-old female here for left ankle pain. So, how did this happen?
It's a little embarrassing. I'm not very coordinated, so I tried to take some snowboarding lessons, and for some reason I just kept falling, and this last time the straps didn't undo, my foot stayed stuck in the board, and it just sort of twisted and popped.
Ouch. When did that happen?
That was last night.
Oh, it was a beautiful night for snowboarding.
It was all lit up, clear sky, it was gorgeous.
Oh, except for this.
Except for this.
And have you been able to bear weight since then?
No, not a bit.
Not really able to walk on it. And have you taken anything for the pain?
I've been taking ibuprofen. It does not seem to help.
Okay. Have you iced it, elevated it, anything like that?
I have iced it and elevated it. It seems to help a little bit, not much.
Okay. What would you rate that pain, 0 to 10?
Solid 9.
Oh, really painful? Yeah. Okay. And do you have any medical problems you take medicines for?
Yes, I have kidney stones.
Okay, and do you just have to take something when those flare up?
Just ibuprofen.
Just ibuprofen, okay. Let's go ahead and check your ankle out. So when I push on the outside of your ankle?
Very painful.
Very, very tender. What about on the inside of your ankle?
A little bit.
Are you able to flex that foot up?
No.
Not at all, okay. So your exam is generally normal other than severe tenderness over the lateral malleolus of the ankle and swelling over the lateral malleolus. Let's go ahead and look at your x-ray. Hey Dragon, show me the radiograph. Okay, so this is your fibula, and I do see a fracture through your ankle, through your distal fibula. So my diagnosis is distal fibular fracture. What I'd like to do for my plan is put you in a knee-high cast, put you on crutches, have you non-weight bearing, prescribe you something for pain, Ultram 50 milligrams every 6 hours as needed for pain. We'll give you 12 of those, and then I want you to come back and see me in 2 weeks and we'll make sure this is healing up okay. Usually you don't need surgery for this.
Great.
Do you have any questions for me?
No, I don't have any questions, thank you.
Oh, you're welcome. Hey Dragon, order the medications and procedures as discussed. And then my technician will be in to put you in the cast and crutches. Hey Dragon, finalize the report. We'll see you later.
Thanks.
What you just saw was a live, completely unscripted orthopedic exam supported by DAX. Beyond ortho, we're now supporting dozens of medical specialties with primary care targeted for 2021. With DAX, we're removing all physical barriers that might get in the way, whether that be the mouse, the keyboard, or the computer screen. It's all about enabling a truly hands-free and eyes-free experience so focus can remain on the patient. DAX uses AI to automatically generate a draft note, which you can see here. It's structured and it happens instantaneously.
There's only 15 minutes in an average family physician's visit. Every 9 seconds is 1% of that visit.
I feel like I get as good a note without all the extra information. And then it saves me a ton of time.
There's no typing, there's no editing notes, there's no documenting while I'm in the room whatsoever.
Too many patients have seen the back of their physician's head as they're typing or dictating.
Every minute that I spend doing something on the computer is a minute I'm not spending with a patient.
Physicians want to spend more time with their patients. Nurses want to be able to understand the patients they're caring for as people and human beings.
We're like, wouldn't it be so cool if someone could listen and watch to all these assessments that we were doing and do the documentation for us? And I'm like, here we are.
It's gonna kind of take us back to the way it used to be when, everything was patient focused.
Whereas before when I was dictating, I would spend a significant portion of the time after clinic, reliving and rehashing some of the patient encounters and finishing my documentation. Now the turnaround time for me finishing my notes and closing my encounters has significantly improved. I bet that my time has been cut into half, if not thirds, because of Nuance now.
The very first note that Dr. Hartman got back, he commented that the story part or the background part that was in the note that he received was so much better than anything that he would have written himself.
Originally, I was a bit concerned that, the note would be of questionable value to me, even if I was convinced I would save some time, but I find my notes are even better. It really takes a lot of that manual work out of the patient encounter and just allows it to happen kind of naturally.
The technology should really be invisible so we can be visible to the patients at the time that they really need us.
Ambient puts a listening device in the room quietly, securely, privately, and allows the two people in the room to really have a very intimate discussion on very private things. Knowing that the necessary recording of that for the business of medicine and healthcare can go on in the background, but letting that personal connection continue. And that's the reason I think almost all of us went into healthcare. It's to express caring, to express empathy, and to connect as human beings.